Time to go inside your health. Medical marijuana is legal in 38 states now across the U.S., and it's been available to patients here in Minnesota since 2015. Despite some state laws, though, the federal government does not allow it to be legal for doctors to prescribe it. And that can have a negative effect on doctors and on patients. But now this may come to an end with new regulations. We have our KSTP health expert, Dr. Arkell Georgiou, here to explain. Okay, so we could see some changes, and the biggest one is this. The Department of Justice is proposing that marijuana be reclassified from a Schedule I drug to a Schedule III drug. So talk us through exactly what that means.
Sure. So drugs that have any abuse potential are classified into different categories or schedules. A Schedule I drug is one that the federal government has decided has high abuse or dependence potential and no medical benefit at all. So what's in that category? Marijuana, heroin, LSD. That's what it's being classified as. Schedule II is high abuse potential, but they recognize that it could have medical benefit. So that's like Adderall, OxyContin. Schedule III, low moderate abuse potential. That's like Tylenol with codeine. Schedule IV, low abuse potential, that's like Valium. And Schedule V is even lower abuse potential, and that's like Robitussin with codeine. So marijuana would go from no medical benefit, not even legal to prescribe, to Schedule III, which is moderate to low abuse potential, legal to prescribe.
That can make a big difference on the federal level. What has it meant to patients so far then? Because we've got medical marijuana in a lot of places now and have had for a while, but to move it from a Schedule I down, what would that mean for patients?
Well, for patients, it's really had them butt heads with their doctors at times. And for doctors, it's been scary. Here's why. In a state like Minnesota or any of the other 37 where it's legal, doctors are told by their state what they can prescribe it for. But if they prescribe that medical marijuana or certify that it can be prescribed, which is how it happens in this state, they run the risk of being charged with illegal prescribing by the federal government, which is what controls that kind of narcotic prescribing, and they could completely pull their license. So there are many doctors, I know many of them, who absolutely refuse to write or even certify patients for being eligible for medical marijuana because they don't know if they're protected by the state laws in light of the fact that by federal law it's illegal. Then they can't take that risk.
It is still a complicated.
Patients go in, they feel that they need it, the doctor may agree, but their hands are tied.
So okay, so what is the most current information on things that medical marijuana can help, on the conditions that are treated? It seems this list is always growing here in Minnesota.
It is growing, but my answer is not going to be the popular answer. So the list that it can be prescribed for in Minnesota is not necessarily the list of what there's good evidence to say it works for. So what's there decent evidence that it works for? Chronic pain, severe or persistent muscle spasms, post-traumatic stress disorder, chemotherapy-induced nausea, some rare kinds of seizure disorders, particularly in children. And then it's been effective in use in palliative care, end of life for anxiety, sleeplessness, agitation. Those are the categories where there's okay data, but actually there's not good data at all on the use of medical marijuana because since it's been in the it has no medical benefit category, it's not getting federal funding for research.
Wow. This could be a big change. And as we wrap it up here, Arkell, tell me real quickly, when could we see this change happen?
So the Department of Justice just filed this new proposal for regulation. There's a 60-day comment period, and I'm going to encourage people to actually write in if they have strong feelings about it because the public can comment on how this plays out, and hopefully the laws will be aligned pretty soon.
Arkell Georgiou, thank you so much.
Thank you.
All right, we'll be right back.